The Montana Obstetrics and Maternal Support Program, known as MOMS, was created to connect rural providers to obstetrical, gynecological, perinatal, mental health, and substance abuse specialists to build competency and consistency across perinatal providers.
Following the 2020 Moms Needs Assessment, we created the Empaths program to create a streamlined path for mothers struggling with prenatal and postpartum substance abuse concerns to get timely access to treatment services so that when they have a baby, they are ready to safely parent.
Empaths is a collaboration of doctors, nurses, and care managers joined forces to connect expecting and postpartum mothers with the support they need for substance use and co-occurring mental health concerns.
Empaths is a huge benefit to patients. Often these are patients that really have not had hope before. They know they have a substance use disorder, but they haven't found the path out of it. Empaths offers them that path.
SBIRT is screening, brief intervention, and referral to treatment. In essence, SBIRT is a tool or an approach to identifying patients who use substances in a way that may be problematic. So intervention may take place, and these patients may be offered the help and support they may desperately need.
And the goal of Empaths is to implement universal screening for all women who are pregnant.
Universal screening is important because mental health and substance use do not discriminate.
There is a high prevalence of substance use disorders amongst pregnant patients, believe it or not. We also know that substance use disorders and behavioral health issues are one of the leading causes of preventable maternal mortality. And finally, by screening universally, we get away from stigmatizing the disorder with our patients.
We utilize a universal screener called the 5 Ps in our OB department, which does a great job of identifying the areas our patients might need support.
After we developed a screening tool, we worked with multiple behavioral health experts in our community to develop a program for our patients that were found to have substance use disorders and developed a way that we could get them quickly into treatment.
So Joe had me do an evaluation, a chemical dependency evaluation, and he sent the information to Rimrock immediately, and I was able to get in within 2 weeks.
They had a bed for me waiting right when I was going to be discharged from the hospital at Rimrock. And from there, the services just branched out. There was resources that it just opened the doors to so many resources. The care manager, Joe Salyer, he was awesome when he came into my room. He just made me feel like I mattered.
Empaths is important for patients as it has the potential to serve as a spark during a time when motivation is high. New pregnancy often lends a hand to an environment in which people strongly desire to become their best selves.
Initially, I was worried about how Empaths would change my relationship with patients. I was worried that they would find it to be intrusive, but I found just the opposite. They're very grateful to be asked about it, and they are thankful that there's someone taking the time to talk to them about it.
Our care manager works with patients via live and telehealth appointments to connect them to behavioral health treatment services and peer and community supports to wrap that mother in the services she needs to be a successful parent.
When I met with my OBGYN for the first time and he asked me about substance abuse and mental health and asked if he could put me in touch with the Empaths program and the Moms program, I was super excited about it.
It's actually helped me a great deal. Like I've always had, Joe's always been there to help me, and I can call whenever I need help, and someone could talk me through my day when I'm having it rough,
I think my favorite part of the program was knowing that I had someone that I could call anytime that I needed and could help me figure out next steps and who I could turn to and what resources were available for me.
They care, they really care, and once you open your mind and your heart, there's so many resources, so many people. There's just a community of people that love and care and want to see you be a mother and take care of your children, and you know, they really do care.
The Moms program, it really gave me a feeling of connection and support and helped me feel like I wasn't alone.
Ask for help and be completely honest. Going through Empaths is probably the best thing you could ever do for yourself and your child.
Empaths also has benefits to providers. It gives them the opportunity to talk with every patient about concerns around substance use. And it also gives them a really clear, easy pathway to refer a patient to services that they need.
Here at Billings Clinic, the Empaths program has proven to be an invaluable resource for our provider teams. It gives them the opportunity to do warm handoffs to our care management team and provides a smoother transition for patient care.
Providers work under a very rigid schedule. The chances of them having the time and appointments to address substance use or mental health concerns that may present are unlikely. Empaths has created a referral path for patients who need support to specifically designated care manager.
Empaths and Espert create a process for universally screening patients because we understand that addiction does not discriminate.
My recommendation to other providers who aren't doing universal screening is to just do it. You'll be surprised at what you find. Your patients will be grateful. And for a lot of patients, this is their path out of a problem they've been burdened with for a long time.
Empaths also benefits the entire healthcare system by identifying and connecting women with services they need early on in pregnancy. Then you're decreasing the likelihood that they'll use emergency services, and also increase the likelihood that they'll follow through with their treatment plans well into delivery.
I've seen mothers reunited with their kids. I've seen the smiles and heard the laughter. It doesn't get any better than that, I assure you.
He just turned 3 months 2 days ago, and he has just flourished.
She's amazing. She's so active and playful, and you know, she's just very strong-willed, and she gets what she wants when she wants it.
Sure, but he's absolutely thriving. He is a super happy, quiet, friendly little boy, and he's amazing.
We invite you to visit mtmoms.org/empaths to learn more about this program that's making impactful change for mothers and babies in Montana and the providers who care for them. We encourage you to take advantage of the Empaths program with your patients and look forward to helping you incorporate empaths into your patient care.
Montana is known as the last best place for our beautiful and plentiful open spaces, including our rural communities.
We strive to make the last best place the first best place to have a baby.